me what makes this place unique. We're kind of like a big old country church. Everybody knows everybody.
People come to us at times of great happiness and joy, and they come to us at very difficult times in their lives, and that it's up to us to really make a difference.
I had been at university a week, and I told my wife, this is where I want to practice. This is where I can serve. This is where I can love.
When I see what they do in the community, in rural areas, in underserved neighborhoods, it fills me with pride.
It's very humbling to see how many people we reach.
I was employed here for 19 years. It was like family.
It's a different culture here. It really does come down to people caring for people, and that's what we're all about. Maybe it's because we're that way that we're still here after 200 years.
Thinking about university in Augusta for 200 years, that's quite spectacular to think that we've had continuous service for that length of time.
Of course, the wealthier patients were cared for in the homes in those days. Most hospitals only provided care for the sick poor.
And so this wooden structure was constructed in 1818 and became a place for these sick poor to be treated. First medical school in the state of Georgia opened in 1828 within the building known as City Hospital. It infused within University Hospital and City Hospital a real mindset around education. The second City Hospital opened in 1869. And the Bishop of Savannah agreed to allow Sisters of Mercy to come here and actually operate the hospital. But those were good years. I think they set the bar high. You had to have a fairly sophisticated program for training medical students or providing them clinical instruction. Same thing with nursing students. So you had the Barrett School of Nursing for white nurses, and then you had the Lamar School of Nursing for African American nurses. Merged after civil rights, 1964, into the University Hospital School of Nursing.
The location on Datnack Street was there for 50 years. The site we're on now, this opened in and around 1970.
We saw the opportunity to build the hospital back, strengthen the medical staff, and expand the services.
They came in with like a long-term plan, and so you always knew where you were going.
In 1984, we were able to wrest control of the hospital from the county government. So we were able to run it like a private hospital.
That allowed us to reach out and do managed care agreements, build facilities in other counties.
That was an unbelievable turning point.
But if they had not done that, today we'd just be an old county hospital.
We were one of the first open heart transplant in the state of Georgia. We were one of the first that did heart catheterizations. One of the first to open up a hospital-based wellness center, first to be involved with the life care community. We're very, very proud of that.
2010, we formed our own insurance company. We expanded to Evans, Georgia, and we built the cardiovascular center.
Mr. Davis, our CEO, came on board. He was very supportive of our heart attack and stroke prevention program, and it has been a very strong part of what we do.
People want care when they want it immediately. So that's why we went out and established prompt cares in the community, and we've kind of made a network of them all across the CSRA.
In today's world, episodes of care are very short. So it's up to us to help them with the continuum of care beyond the current walls. Rehabilitation, extended care facilities to help them stay well.
It's that kind of care close to home that I think people are looking for and are going to demand in the future. Now the good news is the University Healthcare System, and these are 5,000 fabulous people, led by probably 200 really skilled management folks, that this team should see us into the future.
You need help, we'll take care of you.
If you have an illness, insist that you come here.
This hospital is the purest and simplest form of unadulterated love that's delivered day in, day out in the most important way, in service. Service to all.